Nigerians may have to invest in the training and retraining of medical personnel in the healthcare institutions to fill up the wide gap created by health workers' migration in Nigeria. The Chief Medical Director and Chief Executive Officer of the National Hospital, Abuja, Professor Ahmed Mohammed Mahmoud, who stated this at the media pre-briefing on the 25th anniversary of the hospital, said almost every health facility in Nigeria is overburdened.
The World Health Organization (WHO's) doctor-patient ratio is put at 1 to 600 as standard. However, Nigeria's doctor-to-patient ratio is currently at 4 to 10,000, making it far below the global recommendation and becoming more complicated with the current Japa syndrome resulting from bad governance and poor remuneration for health workers. The Chief Medical Director said, though the National Hospital is working hard to address the challenges of shortage of personnel, there is the need for increased investment in human capital development in the health sector.
It hits us bad. Each time we hear that it's going to be a strike by any sector in the healthcare industry, it really hurts us. We get scared. One, because of our patients. None of us here is immune to a disease or a certain affliction. And even healthcare staff, we have seen that during strikes, our own staff have gotten either ill or some certain trauma. The award that is supposed to have, say, 10 nurses will end up having just 1 or 2. And I'm not only talking our national hospital. That's in all our hospitals. You understand? Okay? So that's why the government is talking about increasing the production of this healthcare workforce.
The Chief Medical Director rolled out some of the achievements and challenges of the National Hospital.
Is never closed. So we ensure that, for instance, even if nurses go on a national strike, which our nurses will have to join, the ICU nurses would have to have some certain plan to cover that segment. So all our emergencies and critical areas get covered. So at least at the National Hospital, that is what we are able to achieve. That they need to sort, all sorts of things. It is impossible for us to depend on government for healthcare service delivery, for them to fund this 100%. If we still think that, then we should know that the time is past. We need to really look inwards.
The National Hospital Abuja was first established and named as the National Hospital for Women and Children by Act 36 of 1999 and was commissioned by the then head of state, Abdulsalami Abubakar. It was later changed to National Hospital, which expanded its scope to include all genders and children by President Olusegun Obasanjo in the year 2000. Haz Akodi, AIT News, Abuja.